that I'm going to apply for my Social Security.
I decided to apply for Social Security because of my living situation.
So I decided that I would start collecting at 62.
You are a mature American senior who spent your entire life working grueling jobs, dutifully paying into Social Security, only to discover in retirement that your monthly benefit, the one that was supposed to be the golden safety net for your golden years, has become a cruel burden, barely enough to cover the cheapest rent, buy healthy groceries, or pay skyrocketing medical bills. This is no longer an individual tragedy. It is the shared nightmare of more than 71 million beneficiaries at the end of 2025, after the Social Security Administration announced on October 24, 2025, a measly 2.8% COLA for 2026, an increase that senior advocacy groups immediately branded a slap in the face to baby boomers and systematic betrayal, especially since Medicare Part B premiums are jumping nearly 10% and will swallow almost the entire raise. Let's look straight at the cold, hard numbers SSA released in its official fact sheet. The average retiree benefit will rise from about $2,015 a month in 2025 to just $2,071 a month in 2026, an increase of a pathetic $56, less than the cost of 2 bottles of generic heart medication or half a month's electric bill in Florida. For elderly couples both receiving benefits, the bump is slightly better, around $90 to $100 a month. The maximum benefit at full retirement age creeps up to roughly $4,180 to $4,200. Translated to annual income, the average single retiree in 2026 will get about $24,852. Sounds livable in some places, but in reality, it is pushing millions into hidden poverty, forcing them to skip meals, delay doctor visits, or beg their children for help. The government loves to brag that Social Security keeps seniors well above the federal poverty line, the official metric from the Department of Health and Human Services. According to the 2025 poverty guidelines, still largely used as the reference for 2026 in most programs, the poverty threshold for one person in the 48 contiguous states is around $15,650 a year, and for a two-person household, it is $21,150. So yes, the average 2026 benefit is 159 to 165% above the poverty line. Thanks to Social Security, the official poverty rate for Americans over 65 is only about 10 to 12% instead of 40 to 50% without the program, a talking point Republican politicians love to repeat while claiming the system is working perfectly, no major reforms needed. But that is nothing more than statistical sleight of hand, and this is the part that triggers the fiercest outrage, with many seniors angrily calling the government organized liars. The federal poverty level is an inhumanely harsh threshold designed only to measure whether someone starves to death, not whether they can live with dignity. The far more realistic measure is the Elder Economic Security Standard Index, commonly called the Elder Index, maintained by the Gerontology Institute at the University of Massachusetts Boston and the National Council on Aging, and regarded by nearly every nonprofit and expert as the true benchmark for seniors' actual cost of living. According to the latest Elder Index data, updated through 2024-25, and still the primary reference for 2026 since no full new edition has been released, the national average cost for one senior to live independently, maintain good health, rent housing, and not have to cut essential expenses is approximately $30,792 to $32,000 a year. If the senior owns their home free and clear, that drops to about $25,188 to $27,000. In other words, with the average 2026 benefit of $24,852, recipients only reach 77 to 82% of what is needed if they rent at the national average, and barely meet or fall slightly short even if they paid off their mortgage decades ago. In high-cost states, the situation is an outright disaster. In California, the elder index for renters in major metro areas like Los Angeles or San Francisco exceeds $45,000 to $55,000 a year. The average benefit doesn't even hit 50%, meaning seniors live in constant food and medicine insecurity or are forced to move in with family. In New York, Hawaii, Massachusetts, the District of Columbia, or Connecticut, the required amount ranges from $48,000 to $58,000 a year. Even the maximum benefit of roughly $50,000 to $51,000 a year is barely survival money without additional pensions. By contrast, in the cheapest states, Mississippi, West Virginia, Alabama, Arkansas, or Oklahoma, the elder index is only about $22,000 to $25,000 if the home is paid off. So the average benefit is actually sufficient for a frugal lifestyle and might even leave a little left over. The biggest COLA thief in 2026 is Medicare Part B. On November 14, 2025, the Centers for Medicare and Medicaid Services officially announced that the standard Part B premium will skyrocket 9.7% to $202.90 a month, an increase of $17.90 from the 2025 level of $185. For seniors, out-of-pocket medical costs already consume 13 to 15% of total household spending, double the national average. Result, the $56 COLA increase will be eaten almost entirely by the Part B hike for middle-income beneficiaries, and for those hit with extra IRMA surcharges, which can reach up to $689.90 a month for higher earners, the net raise will be zero or negative. Experts are calling this the cruelest double whammy in recent history, a 2.8% COLA, while healthcare costs rise nearly 10%, turning the annual raise into a bitter joke. AARP surveys show 77% of people over 50 say recent COLAs are insufficient, while the Senior Citizens League recorded a staggering 94% of seniors surveyed in 2025 saying the COLA was too low and 2026 will be even worse. They furiously point out that the CPIW index SSA uses is designed for young urban workers and completely fails to capture the real inflation seniors face in food, housing, and especially healthcare, which often runs 1.5 to 2 times the general rate. Proposals to switch to the CPI-E, an index specifically for the elderly, have been on the table for decades, yet Congress remains silent, leading many to accuse politicians from both parties of deliberately abandoning the baby boomer generation to avoid raising taxes on the wealthy or corporations. The most infuriating and explosive part of the debate is the looming automatic benefit cut hanging over everyone's head. According to the 2025 Social Security Trustees Report released in June, the combined OASI plus DI trust funds will be depleted in 2034, 1 year earlier than previously projected. When that happens, unless Congress acts, every benefit will be slashed automatically by about 23 to 25% overnight, dropping the average monthly check from $2,071 to roughly $1,600. Democrats accuse Republicans of wanting to privatize or cut benefits to shrink the national debt, while some conservative lawmakers claim the program is going bankrupt due to an aging population and argue for raising the retirement age to 69 or 70 or means testing benefits for higher earners. While both parties bicker on cable news, the 25% of seniors who depend entirely on Social Security, millions of people, are literally choosing between blood pressure medication and heating their homes in winter. The brutal reality is that despite staying above the federal poverty line on paper, the 2026 Social Security benefit after COLA is not enough for tens of millions of American seniors to live independently, with dignity, and in safety across most of the country. It is truly sufficient only in a handful of low-cost rural states and only for those who paid off their homes back in the Reagan era. With Medicare premiums devouring the entire COLA, persistent inflation in food and housing, and a ticking time bomb set to explode in 2034, the question is no longer, is it enough to live on? But did we work our whole lives and pay into this system just to be betrayed like this? Millions of American seniors are done waiting. They are furious, and they will make their voices heard in every election from now on.